I'm John Beadle, co-founder and managing partner of Aegis Ventures. Welcome to Consortium Conversations, where we introduce you to the health system leaders at the forefront of health tech innovation. Combined, our digital consortium partners deliver care to tens of millions of people annually and serve as a critical implementation sandbox for new technologies with the potential to dramatically improve the experience of healthcare for patients and caregivers. These are the frontline stories of the innovators whose decisions impact countless American lives every single day. My name's John Beadle. I'm co-founder and managing partner of Aegis Ventures. We're here in our New York City office, and I'm delighted to be joined by David Feinberg, chairman of Oracle Health. Thanks for joining us, David.
Oh, so excited to hang out and have a discussion.
So you've had a really expansive career across traditional provider systems, tech companies, and now health IT. But many people don't know that you started out clinically as a pediatric psychiatrist. What were the early years like of practicing clinically, and what lessons have you brought with you in terms of running big tech companies now?
So the early years were the best years I've had professionally, being able to care for patients and families, especially those suffering from mental illness, children. If you could just change the trajectory of their life just a little, like, you can't call that a job. Like, that, to me, it's just a blessing. So that to me is what the clinical years were about.
So how did your early clinical experience treating children and families influence the changes that you think need to be affected in healthcare across the US?
So what I learned is that patients and families are really suffering. They're not only suffering from the actual clinical disorder, they're suffering from the process of getting care, of affording care, of making sure the care is culturally sensitive. There's some early on cases where I really learned in a very emotional way how important it is to speak to families in a way they understand. They don't really care about our medical jargon. They don't want to have to jump through hoops to get their loved one, the third grade girl who has suicidal thoughts, in for care. They want that care yesterday. And so those lessons are things that I've carried forward to make sure that anything we're doing is patient and family centered, that it's about the community, that it's about really loving your community and loving your patients, such that together with them you can get through the dis-ease, but not create more burden because of the process of care, that it's not understandable, it's not culturally sensitive, it's unaffordable, it's confusing. That's actually all I'm trying to do.
So two of the key lessons I know from your clinical career that you took to leading UCLA on the executive side were expanding access, making the healthcare system easier to understand. What were some ways that you advanced those goals as you were leading UCLA?
So I said, hey, we're going to do same-day access. But what I'm talking about is a mom who's working 2 jobs who happened to get an unexpected afternoon off, needs to come in just for her well woman exam. Well, normally that would be, well, we're scheduling in October, and it would mean she'd have to take time off work. So that was a cultural change to be able to pull that off. And it was actually pretty fascinating how it turned out to play out. So what we really did was expand call to not just night, but day. So once a month or twice a month, you were the generic neurosurgeon on call, even though you're a guy who only goes through the nose and does some very special thing. The patients were thrilled because they got seen right away. And then you'd say to the patient, I'm not the right doctor, even though I've seen you today. But my colleague who practices on Thursdays loves seeing patients like you. So the anxiety went down for the patient. Now every doctor, minus the day they were on call, got exactly the patients they want. If you don't get people in with non-acute issues, give them 3 or 4 weeks with that non-acute issue, and all of a sudden it starts getting a little worse. They show up at the ER, and now they're in the hospital. You literally avoid hospitalizations. You avoid so many things by saying, hey, let's take care of it right away. So that was definitely a lesson early on that has stuck with me.
So you're at UCLA for close to 25 years, and you decide to move to Danville, Pennsylvania. Very different environment. What most attracted you to that opportunity, and what did you set out to do as CEO of Geisinger?
My time at UCLA was about taking care of the next patient and really driving patient satisfaction to the highest in the nation. I get to Geisinger, and it wasn't just loving the patient, it was actually a love affair with the community. It was about this stable population that gets their care, multi-generational at this system. That's why all the innovation happened at Geisinger. That's why Geisinger had, the first kind of what we called proven care, but guarantees around care, money back guarantees around care. Why Geisinger created, when we were there, the largest whole exome sequencing and return results. It's why Geisinger had an insurance arm, because we needed to have affordable care for our friends and neighbors. So I learned how to fall in love with your community, which not like UCLA didn't love the community, but the community is so large in these big urban settings. And then you go to small town America and you literally see the people in clinic, and then at the Friday night football game, and then at the supermarket, and then, at the house of worship. Like, you are of the community. That was the best lesson that I learned at Geisinger.
So you get to Geisinger and you have a health plan all of a sudden. And so there's lots of initiatives you can pursue: whole exome sequencing, food as pharmacy, money back guarantee, that you could never pursue at a large fee-for-service system. What did that teach you about value-based care and how it could be scaled more broadly in the US?
We just did these things because they were right to do. You never had anything. If it was the right thing to do, it happened to align with the business model. So you could just do these things. It's not like in the fee-for-service world, doctors don't want people to eat healthy vegetables. It just doesn't drive the business in the same way it does in a place where everything is aligned. So innovation happened faster in a place that's not particularly the cutting edge of innovation, rural America, because the business model supported it. So these ideas that people had, you were like, yeah, let's do it. And not only was it good for patients and great for the clinicians and make you feel good, it also drove the business. So that alignment was really the accelerant to so many amazing innovations that happened before I got there, my time there, and continue to happen now.
So COVID hit a year into your tenure at Google. Yes. As you look back at what you set out to do upon going in, how much did that shift as the pandemic hit?
50%. So I'd say part of what the shift was instead of building one of those products that has 1 billion users, let's make some of those products that we already have at Google better from a healthcare standpoint. Google's philosophy and success is just to be helpful. And we go back to your question about, hey, how come tech hasn't been good in healthcare? It's not often helpful. So that part was really, really fascinating. And that was a shift. I don't think that was the kind of going in. The other part that continues was, what can we do specific to healthcare? And Google did a lot around computer vision that's now really taken off. When you look at the AI, the Google model, I think, does the best now on any of the med school exams. It beats everyone. So the AI specific to healthcare, computer vision, large language models, as well as organize health information in a way that's understandable, both for consumers and for individuals.
So given the acceleration that you've seen in the last 2 years at Oracle around what's possible in such a compressed period of time, how do you think that impacts what healthcare system executives should be thinking about heading into this current period where you see technology progressing at such a rapid pace?
From a cyber standpoint, and we've seen in our industry some really, really, I would say, scary things happen because of bad actors. So if I'm talking to a healthcare leader today, the kind of concept of first do no harm or don't mess up your brand is people trust you. They go to that local doctor, that local hospital, because it's based on trust. So securing the data, cloud-enabled, military grade security, isn't yet adopted across the industry. That to me has got to be at least one of the very, very top priorities. And the second is be cautious. And now I'm talking about kind of AI. I don't think you have to know how to code, but you do have to know how to ask the right questions. Where was this model trained? Are we using it appropriately? And are we a learning organization that we're continue to see, hey, is this actually helping care or hurting care? Now, I think some really early wins that healthcare folks should be paying attention to, I think we can really decrease the burden around documentation, around pre-authorization, around payment processing, around scheduling. This AI stuff is really good at that. So that's where I would be kind of looking. At the same time, I would be looking at, let's not make the bad stuff worse, and also let's keep it secure. Those to me are kind of the areas that healthcare leaders need to be paying attention to.
So we've seen extraordinary technological progress in the last year in AI. On a forward-looking basis, where do you think healthcare is headed globally, and how much of an impact can technology have in advancing a lot of the goals we've discussed?
When I'm outside the US, everybody says, well, we know it's different in the US, but here's our problem. You could eliminate that sentence because it is literally everyone's same problem no matter where I am. Nurses are too expensive. They're harder to get. Doctors are burnt out. We don't have enough money. Patients are being left behind. There's wait lists. There's people. I mean, it doesn't matter where you go. It's in essence the same problem. Sometimes with a little bit of a tweak, but it's the same issues. There's so many issues that you guys are focused on that I think are the exact types of things that would sit on top of the platform that we're building that make it so the future is now, so that people can call and get what they need 24/7, so that clinicians can spend time holding the patient's hand at the bedside and going over treatment options instead of looking for supplies. Like, I think so much has come together. The financial burden is such that we have to do it differently. So that's kind of the burning platform. COVID, and I don't want to say this the wrong way, COVID was great because it brought to light that care is so inequitable. I think those of us in healthcare knew it, but the rest of the world didn't. So that got brought to light. COVID also gave the whole world a lesson on public health. Like, that was great. I don't think people would have paid attention to bending the curve had there not been a disaster. And the amazing technology that we have, we got all these pieces coming together that I think we can make a fundamental shift right now so that healthcare is safer, more equitable, more culturally sensitive, more affordable for everyone.
So the last time we saw this much buzz around AI in healthcare, it was 2014, rise of CovNets, computer vision. Everyone was saying radiologists were going to be completely automated, workflows were going to be fully automated, IBM Watson had just come to be, and we saw how that turned out. Do you think this generation of AI innovation is new, and do you think it'll work in the way that folks think it will?
So it's definitely better, right? I think we've really advanced the models. But back in 2014, when they were talking about, no more radiologists, what I would say is AI is not going to replace radiologists. But radiologists that don't embrace AI will be replaced. And I think we've now seen that. Like, this, especially in computer vision, it can really help me see things that I can't see. It can get away my kind of, recency bias. It can be that human-computer interface is going to be the place where I think we dramatically advance care. And I think we've now seen that in radiology. But hey, radiology is still a competitive specialty. It's hard to get into. We need more of them. But to you radiologists out there, and I think I'm talking to pathologists and GI, I'm talking to everyone, dermatologists, these tools can be very helpful. In the hands of a nurse practitioner with computer vision, I can make them as good as a primary care doctor as far as understanding moles and lesions. And I can take a primary care doctor and make them as good as a dermatologist with computer vision. That doesn't mean we don't need dermatologists. It means dermatologists will be probably going up another level too.
So David, this has been a great discussion. To close, what advice would you give your younger self just starting out your healthcare career?
I had to do a good job in high school to get into a good college, to do a good job to get into medical school, and then you do well on this board, and then you get a good residency. And it was always working for what was coming next. And I thought, as back then, when I went to business school, there weren't a lot of docs that were getting their MBAs. And I thought, somebody will come pluck me out and they'll take me to some dream job. And what I learned in business school was I was in my dream job. I had found my lab. I just needed to do it right there. And I stopped worrying about what was coming next. So that was a lesson I wish I learned a little earlier. And it's a tough one to say, don't worry about what's coming next. Just focus on what's right in front of you. Just be totally present. I got trained in psychiatry, but the biggest emotional growth I had was in business school. So yeah. Hey, let me ask you a question.
Please.
So you come at this from a totally different world. You come at this from a world of, I'm going to build companies, and you use terms that we in healthcare don't use, like next round and exit and scale. I mean, all that kind of venture studio private equity stuff, right? It's a foreign language to us. But you and the team here come across that there seems to be something way beyond that in what you're doing from a kind of gutsy place. How did you decide? Because you probably could have kept doing what you were doing, building, I don't know, data centers and shopping centers or whatever you were doing before, to kind of say, hey, okay, I got that. I want to make it easier for nurses.
So I've always been really passionate about healthcare. My mom's a nurse, so that's actually an interesting segue. And my mom got very sick when I was young, had a traumatic brain injury. I saw her struggle to access the healthcare system for my entire childhood, and really wanted to figure out how to find ways to drive meaningful change. And so I studied healthcare policy in school, always wanted to try to find a way to make an impact in driving healthcare that's more accessible, more sustainable, more affordable, easier to access. And so as I looked at the different types of opportunities that were available to me, we were doing some early stage venture investing in health tech, life sciences, healthcare more generally, and just saw a huge opportunity to partner with some of the largest health systems to make changes within the existing incumbents that could help drive a more sustainable system. And so that was really what brought me to it. It was a personal experience combined with just seeing a big opportunity to make the world a better place and also be able to drive decent returns from an investment standpoint. So that was what drove me.
I'm so glad I asked the question. I didn't know that.
Yeah. David, this has been such a great discussion. Thanks so much for making time to join us.
Thanks for having me.